Medicare should offer basic dental care for all Australians. So right now, the way Medicare is set up, it is not set up for this. So dental care, you do require private insurance. So this is another contentious issue for us.
But is dental care that's linked with the life threat to life or quality of life is not covered?
So emergency dental care is covered, but not basic dental care. Yeah.
And what about for minors? I mean, for like children till the age of 16 or 18, is dental covered for them by default within the state system?
No, not the basic dental care. No.
It's not covered for anyone. Okay.
No, I don't believe so. I could be wrong on this, but I don't believe that's the case. There's a Medicare subsidy for all health-related concerns, but for dental, it's very small or non-existent in some cases. So we don't get it through Medicare. And
Medicare is the name of the single-payer healthcare system in Australia.
That's correct. Medicare is our national healthcare system. Correct. So any takers?
I'll say strongly agree.
Yeah.
Simply because all other healthcare is covered.
Yeah.
I know that dentists and orthopedicians were all in that carpenters league in medieval England. So if you were a carpenter, if you were dealing with broken limbs, you all were that league and that guild. But we've moved forward and people do need help with it. Not sure why. Obviously, cosmetic care is another thing. But here you're asking about basic dental care.
Yeah.
Which could mean cleaning your teeth and polishing them. And if they're not properly aligned teeth are important to eat well.
Yeah.
So I think basic dental care should be covered. I strongly agree with that.
I would agree with that too. Anything else to add, Aditya?
Arjun, I think I was just Googling meanwhile. It says that in Australia, children between age 2 and 18 years have free basic dental care through the public system. I heard something like that. So that's why I checked quickly.
No,
so that's
I'm glad you checked. So yeah, is that through Medicare or the National Health Program? Because it's a slightly different.
All part of Commonwealth funded child dental benefit schedule.
Okay. Yeah, I think there's a slight variation there, but yeah, I wasn't aware of that. So thank you for that. Yeah.
So what my take on this is maybe cosmetically, I don't know if that needs to be done, but so recently I've gotten my 4 of the teeth at the back removed through the evolution that now we don't need those back 4 teeth. Possibly the government should include removal of those if it is hurting for someone, and maybe some root canal should be included. Maybe not the cleaning of your teeth and maintaining of the teeth, but these things also should be included is what I removal of your wisdom teeth and any root canals, alignment, I am not sure, but these things I think they should be included because dental is costing a lot because you've not increased the wage as well over there. So maybe the dental the government can take it. I agree.
We're playing government here. Like it.
I strongly agree that we need, because that's costing a lot of Australians. So if you have 32 teeth and they all have problem, on average, each teeth is $500. So throughout your lifespan, 32 teeth multiplied by $500 is how much? $16,000 just going for your dental care for each person. And you have family of 4, you make the calculation for yourself.
We should not eat so many chocolates.
Sweet tooth. Yeah.
I strongly agree that all health care should be, I mean, if you have a problem with your tooth, you can't eat. That is a problem.
Yeah.
And therefore, it should be covered.
I think so too. Yeah. So Sarath, we've got 3 strongly agrees.
Do you know, Arjun, which parties are? Do you know which parties has got policies on this?
I'm not sure actually. I'm not sure. This is not an issue that was close to my heart.
But you know what? Thinking of back home, how things are, there's only Palludagottatam program. There is violence, there is punching and things like that. Now, of course, with the Arogyasri scheme, a lot of people have been covered and brought into the care of, though there are political reasons and financial incentives for the parties and for hospitals which were not seeing full occupancy, which is a word we use usually for hotels. This has been an incentive for bringing it in. But a lot of these things in Andhra Pradesh are covered under the Arogyasri program. After the split in the state, it still is reasonably available in both states. That's a very good thing. It's not something available all through the country, but the free medical care for every resident of Delhi has been introduced by the Kejriwal government. I'm not sure how it runs, but the policy itself is something we should all applaud, that things are moving towards that. Now, obviously, one of the big things for the Obama administration and since then has been how to make sure Americans are well covered, protected, under medical services taken care of without having to go bankrupt. And it's a challenge. Actually, one of the reasons many people go to work is because if you're working, you have your medical insurance covering you.
Yeah, that's right.
Now, imagine you're going to a workplace because you don't want to go to hospital without the money, without coverage. It's a trap.
It's
it is
inhumane.
a compulsion. It's not where you're free to choose work. It's a very difficult situation. It's not about hunger. It's about problems of health, and government is not covering it. So basic health care, I say not cosmetic related, optional, elective surgeries and so on, but otherwise should be part of the welfare society.
Yeah. So no gold tooths on your policy. So should we go to Sarath to get, did you have a different take on this?
What do the numbers say on this? Because I think it's highly contextual. Specifically this issue because from what I've read, at least in Canada, in Canada here, basic dental care for children is part of the state, part of the provincial health program. I mean, it's a provincial health program all the time. At least in the province that I live in. I'm not sure about other provinces, but see, the thing is, even in India, right? In anywhere, the costs of dentistry is generally higher than the cost of public health and other healthcare services. So, I think the reason many countries opt to keep dental care out of their public health program is largely because of the costs involved and the scope for fraud, in the sense that if there is an insurance party involved, then you call it insurance fraud, but if it is state involved, then what do you call it? It is fraud. So there is huge propensity for cosmetic treatments, cosmetic procedures to be passed off or to be signed as something that is medically needed. And I think it's because of these reasons, because of this lack of control measures, I think dental care is, it's just that's the reason many countries, they opt out of, keep it out of the state system, and they manage in other ways, like, you might have an employer provided insurance that covers dental plan or something like that. Even in India, right? I mean, dental is costly. India, the thing with India is that, you know, the amount of value you get to the money you spend on medical care procedures is actually pretty high, in the sense that, you know, you get highly skilled doctors who don't even, I mean, whose consultation charges are not that high when you compare it with United States, say, for example. So even there, the cheapest dentistry that you can get is in dental colleges. So I mean, they don't charge so much. So I don't know, maybe if you want to reduce the cost of dentistry, maybe more dental colleges might be the solution. But I don't know, that's contextual again to Australia. I would say Medicare should not offer basic dental care for all Australians as a blanket here. I think there should be other ways that should, other options to be explored to reduce the dental cost, so that, you know, it can be affordable, or, you know, insurance can cover it at very low premium cost. You should not be spending $16,000 to extract your teeth, nor you should be paying $16,000 in taxes to help others, you know, extract their teeth. So it's both.
That's a good way of putting it.
Yeah, it's better, you know, everyone pays like $30 or $40, and then, you know, everyone can have their teeth extracted.
Yeah. I think the latter's the more realistic case for us anyway. But like Aditya said before, we've got the schedule says pays $1,000 over 2 calendar years for children aged 2 to 17 for basic dental services. So that's $500 a year for children to get their dental care, but not for adults. So the Medicare doesn't offer. But I think the bigger issue is there's a lot of confusion around what is bulk billed, what is eligible, what is subsidized. It's just a lot of confusion in different states and territories. So I think one of the movements from the government would be to kind of make it simpler, and it might not cost any extra dollars overall, but it'll just go from state portfolio to the national budget. So so if you're neutral on this, Sarath, then we might just click on somewhat agree, just as a way bridge in between.
Sure. Go ahead. Yeah.
Okay, this one is, how much should Australia spend on foreign aid?